Tummy tuck or abdominoplasty is a procedure to correct problems with both skin, fat, and muscle in the abdomen. The most common reasons for needing a tummy tuck are drastic changes in weight, pregnancies, poor skin quality, and the changes that you can see to your body can be noticed in a couple of different ways. Sometimes when you sit down, there's an extra fold of skin that occurs. Sometimes after a pregnancy or a massive change in weight, your skin's stretched out so much that it tears and creates stretch marks, and the skin quality isn't as good, and so it hangs. You can also have hormonal changes, weight changes, in which case you would build up extra layers of fat underneath the surface of the skin. And even underneath it all, the two muscles, sometimes when you're born, the two muscles aren't touching or together. Sometimes with changes in weight, they can stretch or separate, as they do in pregnancies at times. And if they do separate, they don't magically stick back together again. So no matter how many abdominal exercises you do, you won't get back to that same level of flatness if there's a true separation between the two. Liposuction is used when the problem is just the fatty layer that you can pinch underneath the surface of your skin. So if the skin quality is good and it doesn't hang, there aren't stretch marks or scars. The muscles underneath are nice and tight, and it's just a thickened layer of fat. Liposuction works perfectly. Tiny little incisions, you pass a tube underneath, fat gets removed. Problem solved. But if you have loose hanging skin or stretch marks or scars or loose muscles, then liposuction is not going to fix any of those things. What a tummy tuck does is we make an incision in the bikini line, kind of where you do a C-section. You lift the loose skin up from down low all the way up to the ribs up here. And underneath the skin, we can sew the muscles together and contour your waist and flatten your stomach from the front. Sometimes we do some liposuction at the same time to shape the waist or the back or the love handle region. We flex the bed and pull down all that loose extra skin that we can, remove the extra skin, and leave you with just one fine line at the bottom. The one thing we didn't talk about is the belly button. And the belly button is a tube of skin that's attached to the muscle. So if I actually lifted everything up and pulled it down, your belly button might be off of your body. So we actually leave the belly button as a tube right where it is, pull the skin down and make a new opening for the belly button, which is an advantage because we can reshape your belly button. If it's very wide, if it's very narrow, we can change its shape and really customize it patient to patient. The tummy tuck surgery is one of my favorites, and in fact, because of all the things it can do with skin, muscle, and fat, and reshaping the body. What I've described is a standard full abdominoplasty or a regular tummy tuck, but there are other options. One of the most common misconceptions surrounds the mini tummy tuck or the mini abdominoplasty, which sounds really cute, and oh, I'm not that overweight, I just need a little tummy tuck. But that's not really what it is. What it means to me as a surgeon or any surgeon is we make the incision down low, we lift the skin up only to the level of the belly button. We can put a few stitches in if the lower part of your abdomen is bulgy, and we can pull down and get rid of a little bit of the extra skin down low. It has nothing to do with the length of the incision. So if all of your problem is belly button down, which happens very rarely, I'm a board certified plastic surgeon. I don't know anybody who does more tummy tucks than I do. I do up to 200 a year. I've been in my private practice, this is my 27th year. I guess I've done about 3,500 or so abdominoplasties. And in that time, the number of mini abdominoplasties I've done, 2. So it's very unlikely you're a candidate for mini abdominoplasty, but in some cases that would be an option. Another type of tummy tuck is what I call the modified abdominoplasty or the umbilical float. So what does that mean? That means that sometimes you're kind of in between. You have more than just the little mini abdominoplasty amount, but you can't get rid of all the skin from the belly button down to the incision line. And so what you can do is you leave the belly button attached to the skin. You lift everything up, sew the muscles together, and then you pull down just the extra loose skin and reattach the belly button from the inside. So that only works when it's a small amount of movement. You don't want to have a belly button that's too low. So some people have high belly buttons. Sometimes we use this procedure when somebody's had a tummy tuck with not great results elsewhere and we need to lower the incision. There are certain circumstances in which a modified abdominoplasty might work for you. I would say out of the 3,500 or so that I've done, I've probably done 100 of those, so more likely but still not common. And then there are bigger procedures. There's the inverted T, where if somebody has lost 300 pounds and you're pulling the skin tight this way, sometimes there's looseness side to side as well. And so sometimes a vertical incision needs to be made to pull in the skin this way. Advantage, really nice waist, maximal skin removal, maximum tightness. Minus, you have a big line down the middle of your stomach. So whereas in an abdominoplasty well performed, you can wear a bikini, nobody sees anything. If you have a line down the middle of the body, no matter how well it heals, you can usually see something. And so that's only reserved for special cases. And then for bigger procedures as well, they have a fleur-de-lis where there are extra incisions, or circumferential around the body as well. So there's a whole smorgasbord of abdominoplasties out there, but I would say that 99% of the time, it's a standard abdominoplasty that you would require. Abdominoplasty procedures usually require 2 weeks off of your normal activities. By 2 weeks, what can you do? You can stand up straight, you can walk around, you can drive if you have a driver's license, you can go to the store, go out to the movies, do normal things. The only things that you can't do are heavy lifting, pushing, or pulling because of the repair of the muscle. It's like a similar recovery from a hernia repair. You don't want to tear those muscles or reopen them. By 6 weeks, there are no restrictions on your activities. So at 6 weeks, you can do crunches. I let you go back to the gym at 2 weeks to do walking on the treadmill, stationary bicycle, little arm weights, and we slowly build you up with isometric contractions until the point at which you're able to do all of your normal activities. The abdominoplasty is an incredibly rewarding procedure because of the massive amount of change that can occur over a short period of time. For me, I am quite an experienced and quick surgeon. Abdominoplasties rarely take me more than about an hour. So if you're really, really big, maybe an hour and a half, but that's exceedingly rare. In general, in the public, an abdominoplasty for the average plastic surgeon, 3-ish hours. There's nothing I'm doing differently. It's just that I have it down after so many repetitions. And the shapes that I create, I make it a point to make sure that it balances with your body. A mistake that a lot of surgeons make is they're trying to make you flat, but they're not worried about the curves on the side, or what's below or what's above. So you have to see the big picture. So if I'm flat and square, I'm not happy. If I notice that my waist is super narrow, but I have big giant hips, that might not balance with that. That's also not a good job. So the idea is to create the right body for your anatomy. Each person has a different anatomy. You have to look at the person as a whole. And the consult is so important because I have to know what you want. You know, I can make great looking abdominoplasties to me and to the great majority of my patients, but you're unique, you're an individual, and so you need to create the shape that works for you. And at your consult, we go over a lot of different shapes and sizes. I use the mirror to kind of show you what would work for you and your body, and also to talk about some ancillary procedures that you might consider at that time or at a different time. Say liposuction of the back is a very commonly done procedure at the same time. Sometimes a little fat transfer to the hips is something that can help enhance the curves. There's a lot to it, but I love doing abdominoplasties. I love doing abdominoplasty consults because patients learn so much, and I hope that you'll avail yourself of this knowledge, and if it's not with me, you just make sure that you ask the right questions. So who is a good candidate for an abdominoplasty, and just as important, who is not a good candidate for an abdominoplasty or tummy tuck? Tummy tucks work really well when you're no more than 20 pounds over your ideal weight or the weight that you want to be. The fact that you're not planning to have another child in the next near future, because it would make sense to wait until after your next child in case there's a stretching. The fact that you're emotionally stable, you're stable in your life, you have the financial resources to do it, because tummy tucks are not for people who are obese. They're not for weight loss. Those are different surgeries. It's a reshaping of the body procedure. So you have to think, if you could stand in front of the mirror, suck in your stomach and say, I would be happy if I'm that flat, then an abdominoplasty would make you happy. If it's a lot of loose skin, if it's stretch marks and that skin can be pulled down from your belly button down, terrific candidate for these types of procedures. And also your overall health. An abdominoplasty, although I say for me it's just an hour, it's still the stress of a major surgery. It hurts less than a C-section, less invasive than a C-section, but you have to be healthy, and we have to make sure, because safety is first. Nobody needs an abdominoplasty or tummy tuck. It's for you. It's for looking better. It's for feeling better, so your clothes fit you better. So if you have the right motivations, if you're healthy, if you're not severely overweight, you're not planning on having another child soon, you're happy with yourself otherwise, tummy tucks are great procedures. So conversely, the knots, if you're doing the tummy tuck for anybody else but yourself, it has to be for you and your decision. If you're significantly overweight and you want to lose more than 20 pounds or so, you should probably do the weight loss first. If you wildly yo-yo, you want to get that under control before you do the procedure, because if I do the surgery, I get paid to do the surgery. I'll do the surgery very well, but I don't want you to come back because now you've gained 50 pounds and now you need a revisional surgery or you need another type of surgery. I'm trying to make you happy. I'm trying to give you fulfillment with your body image. And if there are factors other than the physical affecting that, I can't do that in the operating room. That's the work of our ACEs analysis. That's the work of something that we would do outside of the operating room, not the work that I do inside of the operating room. Other people that aren't good candidates, if there's a very thick fat layer, sometimes you're better off doing liposuction first, waiting for healing, and then doing the tummy tuck so that you can achieve a balance between all of the layers. So today's the big day. You're going to have your abdominoplasty or tummy tuck surgery. What's the day going to look like? Well, from the night before, where we'll start, you shouldn't have had anything to eat or drink this morning past midnight so that there's nothing in your system and it makes the anesthesia safest. There are certain medications that we might have you take with a sip of water, such as blood pressure medications aside from diuretics. If you are diabetic, you want to make sure you bring your glucose testing equipment. And then that day, you can come by yourself or somebody can come with you. You'll be brought to a room where you're going to change. I'm going to do some drawing on you with a magic marker. We're going to take some pictures. The anesthesiologist is going to check your blood pressure, your heart rate, your oxygen, make sure everything is good. And then they're going to put it in an IV and give you the medicine you need so you don't see, feel, or hear anything. After the surgery, you'll be brought to the recovery room where you'll stay usually for just simple tummy tuck, another hour and a half, 2 hours. And then somebody has to take you home. You can't go home by yourself. Although you'll get plenty of IV fluids, it's a good idea to continue to hydrate. So Gatorade, vitamin water, coconut water, things to keep you hydrated and replenished are important. You don't want to overdo it with sugary things to avoid nausea. When you go home, you will have had prescribed days prior pain medications and antibiotics. It's always a great idea to pick those up a few days ahead of time because you don't want somebody to have to run out and leave you alone to get them. It's really important that somebody's with you for at least the first 24 hours, just in case you're not feeling well after surgery, and that everything is safe at home for you. You will have follow-up appointments, the first one being the very next day, because we're going to check everything, because if anything is out of place or not where it should be, that's when we would see it. So good luck, and we hope to see you soon for your surgery day. I get a lot of questions when I do consults, and I've done thousands of consults on abdominoplasty, and the most common ones are, what's the difference between tummy tuck and liposuction? Second one is, where is the scar and what does it look like? And the third is, what happens to my belly button? So to answer those questions, the difference between tummy tuck and liposuction is liposuction only does one thing. It does it really well. It removes that superficial layer of fat underneath the surface of your skin. So if that's the only problem, there's no loose skin, there's no stretch marks, there's no scars, the muscles are good, liposuction's perfect. If you have skin that folds when you sit down, if you have a C-section scar that's folding, if the muscles are separated, you need a tummy tuck. Second thing to address, the scar. So every time you cut the skin, you make a scar. And I try to hide the incision in the bikini line so it's in an area where you normally wouldn't see it. There are some special cases in which scars can be vertical or in other areas depending on the amount of skin to be removed. But we try to hide it and make it the best healing scar possible, and that depends also on you doing your part. Third thing, belly button. What happens to the belly button? Because they think, well, if all the skin's getting removed and you pull it down, my belly button's going to come off of my body. So the belly button is actually a tube of skin that's attached down below to the muscle area. And so when I get up to the level of the belly button, we leave that tube of skin, I lift up the skin, we pull it down, and we make a new opening. So it's still your belly button. I'm not making a new belly button, but I can reshape it and make it look prettier. So you're having your abdominoplasty and you're feeling anxious. You're not alone. A lot of people feel anxious prior to a surgery, and it really depends on your level of anxiety. Some people's anxiety is pathological, diagnosable, in which case you need treatment from a mental health professional, or sometimes medications are helpful. And if you already take medications for anxiety prior to the surgery, it's a good idea to take them, especially the night before surgery, so you can sleep. You let our anesthesiologist know as well, and the day of surgery, after the IV goes in, before your surgery starts, we can give you a little medication to relax you. What else do we do? We believe in sound healing. We've created actually original sound healing music of certain frequencies, and that'll be playing in the room to try to help and relax you for it. My personality helps because I'm very calm, and I can instill confidence and try to keep you calm and keep the situation light prior to the surgery. And we move it along at a rate that's not rushing, but doesn't leave you alone in a room for a while with your thoughts. So all of these things are things you can do to reduce the anxiety before the surgery. If it gets to the point where you're too anxious, we would cancel your surgery because we never want to do anything that's uncomfortable for you. To feel anxious is one thing. To really have a panic attack and to the point where you can't think or heal properly, that's dangerous, and that's the point at which we would stop. So one of the interesting questions that you might get is, what is actually tucked in a tummy tuck? And it's really kind of a misnomer. And it comes from the fact when your belly is lapping over your belt, you want to kind of tuck it in so you don't see it. And we're really not tucking anything. What we're doing is, instead of having a fold, we lift up the skin, tighten the muscles, and then we pull down and remove the excess skin. So in a sense, we are tucking the muscles in so the muscles are flatter and getting rid of the fold of skin, so that when you're wearing your pants or skirt or dress, you can wear a belt and look good. You can, tuck your shirt in without feeling poorly. So there's nothing actually that gets tucked inside of you. It's just flattening the muscles and getting rid of the fold of skin so you can tuck your shirt in. So every procedure has risks and benefits, and as a plastic surgeon who is trying to inform you of your surgery before you do it, it's my job, and any surgeon's job, to inform you of the risks and benefits of the procedure. Let's start with the good stuff. The benefits are, you look better. It's totally a cosmetic thing. In certain cases, there are non-cosmetic benefits, such as if you have a fold of skin or an irritated scar that gets super infected or gets rashes in the summer. That's an actual medical benefit that you're getting. If you have back pain because your stomach is hanging down, that's a medical benefit. Other benefits, aside from aesthetic, are you can change the type of clothing you wear. There are mental health benefits in changing your self-image, the way you interact with other people as well. But there are risks of the procedure. Every procedure has 3 risks: infection, bleeding, scarring, and tummy tucks are no exception. Infection in tummy tucks is quite rare, less than 1% in my practice. Bleeding, in 3,500 tummy tucks, I've had 2 that had some bleeding that needed to be addressed. Scarring, 100%. Every time you cut the skin, you make a scar, and it's my job to hide it in the right spot and to do everything I can to make it heal as nicely as possible. It's your job to inform me of any scarring irregularities you have in your family or in yourself, and that you follow the instructions. And if you come to your follow-ups and I see the scar is a little red or a little brown or a little raised, there are things I can do in that moment to stop the process and improve it. If you wait and come back 2 years later and say, I don't like my scar, we're starting from ground zero, and it's much, much harder to correct. So it's both of our jobs to make sure that it heals well. Other common risks in tummy tuck surgery: seroma. And what's a seroma? When you're doing a tummy tuck, you're lifting the skin up from here to here. And so it's all lifted up, tightening the muscles, pulling it down, and you think of the healing as the line, but this whole surface has to stick down. And as the surface is sticking down, it's a process that creates fluid, and you have a small drainage tube at the time of a tummy tuck to remove that extra fluid, and we remove that tube when it's below a certain number. But in some cases, you can still keep accumulating fluid underneath the surface of your skin. That happens, I would say, in 3 to 5% of patients. It's very simple to extract the fluid without surgery with a small needle. The nice thing is your skin is numb in the bottom part, so you don't really feel it at all, and that might have to be done a few times if you are somebody who accumulates extra fluid. Let's talk about the biggest risks, the things to worry about the most, because it would be unfair of me not to inform you on them. The biggest risks in this type of a procedure are what they call VTEs, venous thromboembolus. And so what they are blood clots that can form in your legs. Blood clots form in your legs sometimes because the circulation is abnormal or there's an anatomic problem, or some people have a genetic predisposition to it. If you have had blood clots in the past, you have a higher risk of having blood clots, a family history of it, taking birth control pills. There are a couple of things. Even having COVID is a risk factor for having an enhanced ability to form clots in your legs. Before the surgeries themselves, we assess your risk for it. The average patient has a risk of about 1%, so it's not really high, but it's not zero. And I take steps to try to reduce this risk. What do? The day of surgery, you're going to get an injection of a blood thinner before surgery to make it harder for you to make the clots. We're going to put you in compression stockings that you take home and wear for the week to help you with your circulation. And we have a machine that massages your calves all through the surgery so that blood is always flowing. And when you go home, we make sure that you don't just lie there like a zombie. You do little ankle rolls like they tell you on long plane flights. And every 3 hours or so, you get up and walk for 30 seconds. That's what they tell you after pregnancy because it's similar to the risk of blood clots in pregnancy. And so it's no more risky than a pregnancy blood clot. So if you've had pregnancies before, you have somewhat of an indicator, but they're not 100%. So those are the things we do to prevent them. How do you know if you have a blood clot? If you should notice that one leg is more swollen than the other, or you have pain behind one knee, not the other one, those are indications, or you can see a visible vein that wasn't there before. That's when you call me. We do an ultrasound and assess you. And if there's a blood clot, it's usually just taking some pills to dissolve it and figure out why you formed the clot. There's nothing that I do or any other surgeon does in the OR that causes the clot. We're not manipulating your legs. It's just a byproduct of being under anesthesia in an operating room. That's one of the reasons I like to try to do the procedures more quickly, because the less time under anesthesia, the less time that the blood isn't circulating as well. The main peril of having a blood clot in your leg is all the veins in your body eventually drain back through the lungs to get oxygen. And so if you have a blood clot in your leg and you ignore it and don't do anything about it, eventually, usually within the first week or two, that clot can break loose and it will go into your lungs. And if you get blood in your lungs, much harder to breathe. And so this happens less than 1% of the time. So what do you watch out for? It's normal after surgery to feel tight, like you can't take a deep breath because I've just tightened your muscles. It's normal if it hurts in your belly if you cough because I've tightened the muscles. What's not normal is everything's okay and all of a sudden you're short of breath, you can't catch your breath. Or you start coughing and blood comes out, which I imagine would alarm you anyway. Or if it hurts in your lungs to breathe, and it sounds weird, but you're taking a breath and it hurts for the air to come in, do not call me, call 911 immediately and say, I had surgery recently, I'm having trouble breathing, or I'm coughing up blood, or it hurts in my lungs to breathe. My doctor thinks I might have a blood clot in my lungs. They will do a CAT scan. If there's a blood clot, they will give you medicines to dissolve it. While I can't prevent blood clots, nobody can, I can assess your risk for them and let you know what that would be. And I can educate you like I'm doing now so that if it happens, you know exactly what to do, you don't waste any time, and that keeps you as safe as possible. Those are the main risks that we watch out for. Obviously, there are others like temporary loss of sensation or skin sensation loss, healing issues, circulation to the belly button. There are a lot of small risk factors, but before your surgery, you will read through an entire packet that lists every single known and common complication, and you'll discuss it with your surgeon beforehand if there are any questions. In my practice, I have you fill it out, the nurse goes over things with you, and anything you put a little check mark next to you're unsure of, we go over 100%, because it's okay to be nervous before a surgery because you're an intelligent person, you realize that it's a surgery and you're not getting ice cream. If it's not normal to feel like you don't have confidence in the surgery or something is going to go wrong. So it's my job to inform you of the risks. It's okay if you're nervous, but you also should have the confidence that you're in the right place and everything's going to go well. So how do you pick a plastic surgeon to do your abdominoplasty? It's a great question. So first things first, as always, you want to make sure your plastic surgeon is a real plastic surgeon. What do I mean? You can open your own clinic and say Smith Plastic Surgery, even though you're not a plastic surgeon. And any doctor with an MD degree in New York State can do any surgery they want to legally. So they can do liposuction and facelifts even if they're a pediatrician or an OBGYN or a physical and rehab medicine doctor. So you want to do your homework. So you want to do research. So the best way and the quickest way to go about it is to go to plasticsurgery.org and type in the surgeon's name. And if it doesn't come up, they're not a member of the American Society of Plastic Surgeons. And that's your leaping off point to ask them, what specialty did you do your residency training? So you know who you're getting. And again, it's not illegal. I'm not saying that a pediatrician can't do liposuction, but it's not what they really train for. And you want to know before you do your surgery whether or not that's the route that you want to take. Second thing is, just because I'm a board certified plastic surgeon doesn't mean I'm great at abdominoplasties, because I've seen some really bad abdominoplasties. And you want to know the aesthetic eye. So how do you do that? On the website, you want to look at before and after pictures. Try to find people that look like you as the before and make sure that you like the afters. If there are 5 pictures and you don't like any of them, chances are that's not the right surgeon for you, because he could say, oh, you want it to, oh yeah, I'll do whatever you want. If he had good pictures and he had better results, they would be on the website or on the social media or somewhere where you can see them. The other thing to do is to ask, how many tummy tucks do you do each month? How many tummy tucks do you do a year? How long have you been doing tummy tucks, and how many have you done total? So, you know, I do an inordinate amount of tummy tucks, and it wouldn't be fair to say if you're not doing at least 100 tummy tucks a year, you don't know what you're doing. No, but you should do a couple of months. So I'm thinking at least 25 as the bare minimum a year to make sure that you're in practice and there are enough people that trust you to do an abdominoplasty. And you should be able to see a substantial number with shapes that you do like. And then the ultimate thing is you're going to meet the surgeon. You're going to get a feeling, I trust this guy, I don't trust this guy, he knows what he's talking about, he makes me nervous. And if you come to my office and you feel uneasy, run away from me, because you know the energy and the connection isn't right, and it has to feel right, because remember, you don't have to do this surgery. This is a luxury that you're doing for yourself because you want to look better. And if it's not the right situation, not the right doctor, not the right time, no matter what the cost is, don't do the surgery. So you're getting ready to do your abdominoplasty. Congratulations on finding a great surgeon and finding the person that makes you feel comfortable and understanding the risks and going for it. So what can you do to help you prepare for that experience? 1, nutrition. You want to make sure that you're on a healthy diet, healthy lifestyle, because you want to maintain the results of this procedure. Plus, you want to have all the things you need to heal well. So after a nutritional analysis, it's easy to tell, but if you don't have a nutritional analysis, make sure you take a multivitamin with iron for a few weeks before the procedure to make sure that you have everything you need to heal. Make sure you're well hydrated, drinking plenty of fluids, coconut water, to make sure that your body is primed for healing well. Make sure your recovery space is comfortable and relaxing for you, because you don't need any additional stress. So make sure you're not having to climb a lot of stairs. Make sure the bed isn't too high. Make sure there's a step stool if you need it. Make sure your car is prepared for taking you back and forth. Make sure you have the people to help you for meal prep, that child care is taken care of, that elderly parents are taken care of. So the only thing you have to concentrate on is you and your healing process. So you need to set all those things in place prior to make the procedure go well for you.